Good morning and welcome to another episode of Coffee and Tea with AARP Connecticut, a biweekly conversation in which AARP talks about policies and programs that are of interest to the age 50 plus and their families. My name is Nora Duncan and I'm the State Director of AARP Connecticut. I am joined today by my advocacy and outreach team, Doroghazi and John Erlingheuser. Today, we're going to do things a little bit differently than we usually do, and we are going to talk about where things stand around our priorities in the 2022 legislative session. So this conversation is pre-recorded, and at this time of year, with the legislative session wrapping up the first week of May, things start to move really fast. So I would encourage folks to look up the legislation we talk about at cga.ct.gov, or even drop a question in the chat for updates. We're going to take a few weeks off from Coffee and Tea, and we will be back on May 26th with a session wrap-up show. So John and Anna, welcome. Good to see you here virtually today.
Morning.
Thanks, Nora.
I think I will start with John. John, we know that we've been working hard on issues related to elections, and can you give us an update on some of the changes that have either passed or that the legislature is contemplating passing regarding elections?
Yeah, thanks very much, Nora, and glad to be with you all this morning. It's a great question. So there have been a lot of changes to elections-related laws in the last year or two, and they've been good changes that are going to help make it easier for people to cast their vote, particularly in times that are trying like we are in now with the pandemic and COVID-19. And I'm very happy that AARP was able to work on this year a piece of legislation, House Bill 5262, that would change what the definition is to allow folks to vote by absentee ballot. And what that now does is, prior to this piece of legislation, there was a very prescriptive series of things that would only allow you to use an absentee ballot. So you had to be out of town the entire day of operation of the polling place. So that would be 6 a.m. to 8 p.m. Or you would have to be sick yourself and you wouldn't be able to go to the polls. So things like the pandemic wouldn't allow you to vote by absentee ballot. Caring for a loved one would not allow you to vote by absentee ballot. Many people did unintentionally, but needless to say, that was not what the law states. So now what we did is passed with some allies in the current Secretary of State, Denise Merrill, legislation that will allow for folks to use just sickness in general as an excuse to vote absentee ballot. So for example, we're in the pandemic. The pandemic could be your fear of getting sickness, and that would make you eligible to apply for and vote in this election by absentee ballot. And if you're going to be out of town at all during the election day, not necessarily the entire hours of operation of the polls, you would also be allowed to vote by absentee ballot on election day. So those are great things because it'll expand the franchise for many people, make it more convenient. And we did have a series of temporary changes starting in 2020 and 2021 at various points to allow more access to absentee ballots because of the pandemic. And what that proved was that it was overwhelmingly popular by the public, AARP members and older voters in particular, and those that are older who are still working. So, we're very encouraged by this, and we encourage people to examine all their options for voting and determine whether or not that voting by absentee ballot is the right thing for them. We also have currently House Joint Resolution 14, which passed out of the Government Administration Elections Committee, and that resolution would allow for no excuse absentee balloting. And so currently in Connecticut, just previous legislation, those are the only reasons you can vote by absentee ballot. But there is a resolution that would remove the prohibition on no excuse absentee balloting, meaning if you want to vote by absentee, you can. That would need to get 75% of the vote in both the House and in the Senate. That's not necessarily likely going to happen, but if it doesn't, we passed it by a simple majority in 2021, and we can come back again and do it in 2023, and then the voters will get to decide whether or not we should be able to have no excuse absentee balloting in 2024 election cycle. And right now, as I say, we're going to have a ballot question on the November ballot to remove the prohibition against in-person early voting, because in Connecticut, election day is the first Tuesday after the first Monday in November. And if that question passes, then the legislature will make rules to determine what it means to have in-person early voting. And if it fails, then we're back to the drawing board. So those are kind of the whole array of things that are happening with regards to elections and absentee voting and in-person early voting. And we encourage voters to look at all their options, and if it's right for them, cast a ballot in the most convenient way for them.
Great. Thanks, John. I'll just make a quick note of our website that has all the information people need for the 2022 election cycle, which is aarp.org/CT votes. And so next I will go over to Anna. Now, Anna, you and I both know this, but we'll let everybody else know that, AARP's mission is to empower people to choose how they live as they age. And we know that a lot of older adults want to age in their own homes. And there are bills this year that could support that. And I'm wondering if you could give us some high level on those.
Sure. So as you just said, we know from talking to AARP members that one of the most important things to them as they age is having the ability to choose where they live, whether it's their current home, whether it's another place in their own community. But that choice is really important to people. And they also say that if they reach a point in their life where they need some kind of long-term care, supports, or services, they have a really strong preference to receive that care in their home or in the community instead of in an institutional setting like a nursing home. So there are 4 bills that I'll touch on just really quickly this session that all relate to that. One bill would create a home and community-based services ombudsman. We have a wonderful long-term care ombudsman program here in the state of Connecticut. Mairead Painter is our state ombudsman. She's been on Coffee and Tea before. Her program and the long-term care ombudsman program currently only provides services to people who receive long-term care in institutional settings. The state's done a lot of work in recent years to serve more folks in the community, which, as I said, is where people want to receive services. But the ombudsman program services have not followed folks into the community. This legislation would create a program to expand the program and provide those ombudsman advocacy and support services to people who are still receiving care in the community. Another bill that we're really excited about would change the community spouse protected asset limit. This is one of those kind of wonky Medicaid policy things, but I think the important part here is when a married individual moves into a nursing home, his or her spouse who remains at home has to spend down their assets to a set amount before the institutionalized spouse can become eligible for Medicaid. The bill before the legislature this session would allow the community spouse to retain a larger amount of assets to stay in the community. There's also a bill related to homemaker companion services. These are folks who are providing services in the home that are not health related. These are not the home health aides. These are folks who are coming in to provide some assistance with cleaning, some personal care help. Maybe they're helping out with some of the cooking and some of those other non-medical things that can keep people in their homes. This bill would just study what those services look like and look at areas where we might need additional policy intervention and some improvement for those services. Finally, there is a bill that would expand access to the Connecticut Home Care Program for elders. This is an incredibly popular program that serves more than 15,000 adults in Connecticut who would otherwise be institutionalized each year. The bill before the legislature, and this was included in the appropriations budget, would increase the asset limits for the state-funded portion of this program and lower the program copay from 4.5% down to 3.5%. So should make more people eligible for this really important program.
Thanks, Anna. So when we think about people staying in their home, one of the things that might not be as immediately thought of in my mind is dealing with high-speed internet. And so, John, why do people need high-speed internet to stay in their home in so many cases? I'll give you one example, right? Telehealth, something that became very popular over the pandemic and remains so. John, tell us about some of the proposals that are being considered that will deal with high-speed internet and making sure more people have it.
Yeah, I mean, you're really right there, Nora. What the pandemic really showed was that how great of a need there is to have the internet, whether it was for telework, telehealth, virtual visitation with loved ones in a residential care community, you name it. I mean, there was just, pandemic really showed that there was this need for high-speed internet. On the other hand, it also showed that there was a lot of deficiency in the ability of folks in the state of Connecticut to get high-speed internet, particularly those in urban settings or rural areas, or folks that were low income or lived in multi-family dwellings. So the federal government, through several pieces of legislation, is providing a lot of money for the states, and in Connecticut in particular, to continue to fill in the gaps that exist in our high-speed internet system. And we're very encouraged that Governor Lamont has taken a lead as it relates to high-speed internet, and because it's not just important to help those that are unserved with high-speed internet. We want to help those that are underserved as well. So one of the big things that's really important about what the governor is trying to do, and these things are in the budget and part of the budget negotiations, right? Because we have to kind of earmark how this federal money is spent. But one of the things is kind of this build out of high-speed internet from the curb to the home in low-income areas and multi-family areas, and as well as businesses. So, we can get that infrastructure to be able to provide those services to folks. So that's a critical piece of the puzzle. And there's also going to be the ability to kind of interconnect all of the remaining libraries in the state of Connecticut that don't have access to high-speed internet. That's a critical thing for people, to be able to go into a library and do the research that they need, whether they're a student or they're just a regular individual who doesn't have the hardware to be able to access the internet at home, even if it's built out. So there are some really great proposals. We're happy that they've survived the initial budget negotiations, right? So now we're in the final weeks, as you said, and so a lot is going to be negotiated out. But we're hopeful that a lot of these projects are going to survive, particularly those that really are going to build out that service in the and underserved areas. And that's why, those were priorities for us at AARP. And we're happy that they were priorities for the Lamont administration. And so far, it looks like they're priorities for the legislature. So now we just have to kind of get through these final weeks and make sure that these things survive, because, it's really, really critical. People get shut off from the world in 2022 without access to good quality service, and that service has to be affordable as well. And I would also encourage folks to look into the Affordable Connectivity Program, which provides grants for folks up to $30 a month for access to the internet, as well as up to a one-time $100 benefit for access to the internet by buying hardware, whether it's a phone or a tablet or desktop computer. So those are great things. Folks can go to the AARP.org website and find out about the Affordable Connectivity Program and whether or not they're eligible for it. So, a lot happening. We're a lot better off today than we were yesterday, but there's still a lot more that needs to happen tomorrow, and we're going to try to do our best to make sure it does.
Great. Thanks, John. You mentioned some federal stuff, and I think a lot of our members are probably familiar with our federal advocacy work to lower the cost of prescription medication. But they might not know as much about our state work, which has been going on for years, and this year as well. So Anna, I'm wondering if you want to do a little explanation of what's happening at the state level in terms of making prescription drugs more affordable for people.
Sure. So we worked hard at the beginning of the legislative session on a bill that would have created something called a Prescription Drug Affordability Board. That legislation had a public hearing. We had the opportunity to speak about the issue, but it was ultimately, not successful in getting out of committee. There is a bill that is still live as of the recording of this conversation, an act reducing prescription drug prices. And there's a piece of that legislation that would allow Connecticut to seek federal approval to import prescription medication on a wholesale basis from Canada. Canada has really similar safety and quality standards as the United States. So this wouldn't be a personal drug importation program where as an individual you would be accessing medication from Canada, but it's a program where the commissioner of the Department of Consumer Protection here in Connecticut would designate, one or more wholesalers to import and then distribute these drugs from Canada. So why Canada? Well, we know that there are just too many Americans, too many Connecticut residents who can't afford their prescription medication, and lower cost prescription drugs are available pretty much in every other country, including our neighbor to the north. So Canadian brand name drugs are around 28% of the cost of drugs sold in the United States. So having access to this market for medication that is identical, that goes through a lot of rigorous state safety protocols in Canada would be a really big help. And this is something that other states have looked into in recent years. I think Vermont, Colorado, Florida, Maine, New Hampshire, and New Mexico have all passed legislation that would allow them to seek federal authorization. Once this passes, again, I keep mentioning federal authorization, the Federal Department of Health and Human Services would need to approve these state plans in order for the programs to go live. But it is something that, other states are looking at because people are really desperate to have some kind of relief for the high cost of prescription drugs.
And I will note that we are still working hard at making the federal push, our advocacy push there for Medicare to be able to negotiate the cost of prescription drugs so that Americans, all of us who are paying for this through our tax dollars, as well as those of us who are on Medicare, stop paying the highest prices in the world for prescription drugs. So we're going to stay tuned on that one. John, let's keep talking money, but let's talk taxes and the budget. So there's a lot more money laying around than there have been in the past few years, and everyone seems to be talking about tax cuts. So what are some of the ones out there that we have taken a position on, and where does that stand now, John?
Yeah, I mean, a lot of good things have been either voted out of the Finance Committee with regards to taxes or the Appropriations Committee, and are a part of the two pieces of the budget that are currently on the table and being negotiated. And a lot of the things that AARP members want and that we supported are still in the mix. So I think the first thing I'd really like to talk about is right now, AARP fought very hard over the last several years to pass, expand, and maintain the legislation that will phase out the taxation of retirement income. So things like Social Security, which is already phased out, pension and annuity income tax. Those are things that we fought very hard to happen. And what the budget now has and the legislation that's passed out of finance has would move up that phase out so that taxpayers will be able to deduct 100% of their eligible income beginning in the 2022 tax year. So under the current law, that wouldn't happen until 2025. So that's critical. There's also legislation in that realm that would increase the amount of income that people would have that would qualify under this program from $125,000 for married couples up to $150,000, which only makes sense because single individuals up to $75,000 qualify. There is a flaw here that we'd like to see fixed, because if you make right now under the law $75,001, or as a married couple $125,001, you're eligible for zero of the benefit of this phase out. So really what we'd like to see is not have these kind of cliffs, and have a step so that, you get part of the benefit of this program as your income increases over the current limits. So that's something we've been pushing very hard so far. The legislation, will increase the phase out of the retirement income to this taxable year, 2022, increase the limit to $150,000 for married couples. It's a start. It's a good thing. It will help individuals because, as of 2018, 29% of Connecticut's population contributed 44%, or $124 billion of the gross domestic product of the state. And that's older adults, right? I mean, so those are the people that we're talking about that are in this category of paying retirement income. So they contribute a lot more than they take out of the economy. And so it's important to do that. Then just quickly, there's a proposal to increase the property tax credit on your income taxes. That's if you pay property taxes on your home or your car. There's proposals to increase that from $200 to $300, and then from $300 to $400, and then expand the number of taxpayers who can actually claim the credit by eliminating the provision that restricts it to just seniors and people with dependents. So that's a lot of folks that are out there, and a lot of them that are working members that will benefit from this expansion. And then also, there's a few proposals to really deal with car taxes, right? I mean, car taxes are a very inequitable way of taxing in the state of Connecticut, because if you live in a city, you have a very high mill rate. You can have a very old, a low value car, and you can live in a more affluent town and have a low mill rate and have a more expensive car and be paying more in taxes than the individual who lives in the city. So there are several proposals out there to address this. And, one of them would say reduce the car tax in a lot of towns by capping the mill rate, at 29 mils, so that anything over 29 mils, you would no longer be taxed on. So if you're in a town like mine, for example, where we pay 37 mils, individuals in my community would get a break on their car taxes because we would only be taxed on the 80% of Blue Book value at 29 mils. So that's a great proposal to help the majority of taxpayers in the state of Connecticut that pay car taxes. And then, again, there's also a proposal to kind of reduce the car tax bills by capping, the assessed value on each $1,000 of each assessed value of an automobile. So there's a lot that's happening. It's very fluid. The budget negotiations usually result in compromise. So I'm sure not all of this is going to happen, but I'm sure that some versions of this will happen, and it will be good for taxpayers. I just have to say, people have to be clear. We can't do everything at the legislature right now on tax reduction because, as you alluded to, Nora, there's a lot of money because our tax rolls are growing. That was one of the benefits of the last couple of years. And then there was, in addition to that, an influx of federal money. But when the state accepts federal money, there are limitations on what they can do with it. So you cannot reduce taxes by taking federal money, right? The federal money has to be spent. So you can only reduce taxes by the amount of money you had that was in surplus, aside from the money that came from the federal government. So it's a tricky patchwork of things, and every action has another reaction. So we're hopeful that we'll be able to maintain the spending that's needed on the important programs that Anna did, but at the same time, provide relief in these really trying economic times for folks in Connecticut. So we're hopeful.
Great, thank you. And there's just so much that we are working on. We're not going to get into it all here today, but that's just a sample of some of our priorities. And like I said, we're going to take a few weeks off. We're going to finish up the legislative session, and we are going to come back on May 26th and tell everybody what happened. So that'll give us some time to digest, some time for folks to track what they're interested in. Again, it's cga.ct.gov is the state legislative website. And you can also find your legislators there and tell them what's important to you. So I appreciate you two both being here today. And thanks for all the hard work you do. And kudos to our volunteers who also advocate on behalf of Connecticut's age 50 plus and their families.